Hello, this is A Touch of Health. Today we are discussing, or we are learning, as well as interacting on the many things that makes us healthy entirely as a human being. Many people do not know that they have sickling or not. People do not even know their blood groups. Others do not know what their blood pressure is. People also do not even know when they are critically ill and need to seek hospital attention or be at home and self-medicate. We are not encouraging self-medication, but sometimes you may need some sort of first aid at home before you can be transported to the hospital. And that is what we advocate. Because many people end up staying back in the house till the diseases or whatever is happening to them gets worse off. Then they seek medical attention. If you get to a hospital in an emergency situation, sometimes there may be the short window period where you can be saved. If the question is put to you, what is your blood group? Maybe you need blood. What will your answer be? Would you be able to say it? Or would you be like me? There are many things that we take for granted these days, and it is at the most critical times that we realize that these things are very, very important. There's so much noise made about sickle cell and knowing our status. This is a peculiar thing happening within the Africa region, and that is why it's a key health challenge that requires battling. Do you know your sickling status? If you do, a thumbs up for you. If you don't, please don't be like me. Try to find out. Make it as part of your routine. Do a checkup next time. Make sure you know so that going forward, it helps informs decisions that you make and how you live your life. People who live with diabetes and hypertension are no exception. Most of the time you meet people and you ask them, what's your blood pressure? And they are looking at you as if you've asked the $1 million question. If you already have ever checked your blood pressure, you would know at a point when it is rising or it is low. Or even the person that checked your BP would have told you that your BP is either a high, a low, or a normal. So based on that, when you go into any hospital and you have asked, or you are asked, have you checked your BP before? You can confidently say yes, quote the figure, and the healthcare staff will be very proud of you. You need to know the numbers. Knowing the numbers is critical for people living with hypertension and diabetes. So that you know when things are changing with you, you know what to do. When medications are not optimal, by optimal we mean sometimes your medications need to be added or decreased. Most people do not even check their sugar levels to the point that even when the medications are further dropping their sugar level, they don't even know. They always think that doctors are willing or ready to add medication. No. Sometimes doctors have to reduce your medication, and that is dependent on what you feed them with. Knowing the numbers is critical in every aspect of our life. You need to know your blood level, that is your HB. You need to know your sugar level, that is in diabetes and all the other people. You need to know what your blood pressure is. That is also key. You need to know what your weight is, because it ends up in calculating your BMI, or what we call BMI, which determines whether somebody is obese or not. Being obese has its own consequences. And so we need to know the numbers. There are lots of numbers when it comes to the hospital setting. Do not be surprised when you are asked. Do not be intimidated when you are asked. Just try to know your numbers. We hope that this video has been helpful to you. Knowing the numbers is very key, and we expect that by the end of this, you should be oriented. You need a pen, you need a book, a little notebook, so that you can keep account of your numbers. Being accountable for your numbers is for your own good as a person that wants to live healthy. I challenge you today. Know your numbers. Thank you.